just give it a few seconds.
Mhm.
So welcome to the CWK show, Conversations with Katinda Live, where we talk about this thing we call life. In today's show, I'm so delighted and honored to have the fabulous Dr. Chris Lemo. And Chris is an infectious disease physician who will shed some light on these anxious times that have been imposed upon us by COVID-19. Welcome to the show, Chris.
Thanks, Katinda. Good to see you.
Nice to see you too. Now, Chris, in our conversation today, we will be sharing, educating, and informing as many people as possible to understand and evaluate the fears of COVID-19. So, what is COVID-19 and how did we get here?
So COVID-19 is a disease that's caused by a coronavirus. The coronaviruses are types of viruses that are related to the ones that cause the cold, the common cold. But this one's a particularly nasty one, and it's a new virus in humans. It only really appeared late last year, and it seems to have spread very, very rapidly around the world.
Right. And is it, in fact, is this coronavirus, is it something that we should be afraid of? Is it something we should just not worry too much about or just do the right thing?
We certainly need to take it seriously. Most people who get it don't get too sick, but some people get really, really sick. And because it's a new virus in humans, nobody is immune to it, which means everybody can get it. And that means that even the fraction of people that get it who become seriously ill is a small fraction, but that ends up still being a very large number of people.
Right. And I'm just looking to make sure that we're actually broadcasting, just to make sure.
Mhm.
Now, as an infectious disease physician, what are some of the trends you see in regards to people resisting to be tested or to wear the masks?
I think the masks is a big topic. There's a lot of talk about masks, probably too much talk about masks.
Right.
So basically, if you have the infection and you're wearing a mask, then if you cough or sneeze or breathe or speak, the viral particles that would otherwise spray out and land on everything around you will get caught by the mask. And so you're less likely to infect other people or to, leave the virus on the area around you that people can get infected from. If you don't have the infection and someone else has the infection and they cough or sneeze or something on you and you're wearing a mask, then there's less of your face that is exposed to the virus.
Wow, okay.
So it does help.
And how many people have actually gotten COVID-19? Just a rough estimate. This could be internationally, it could be here in Australia, could be Victoria.
Internationally, I can't remember the figure today, it's well over 10 million now.
Wow.
In Victoria, it's over 3,000 people now that we know of.
They've been tested in that case.
Yeah, been tested and had a diagnosis, yeah.
And what makes the coronavirus so good at spreading?
It's a pretty it's a very resilient virus. So it lives on surfaces. So if it lands on a table or on your hands, if you cough on your hands, it stays on your hands for a little while. If it lands on a surface, it stays for longer, a few hours. So someone else can touch that surface with their hand, and if they touch their nose or their mouth or their eyes, then the virus gets in. So it's quite infectious. Just like a cold is infectious. The tricky thing with it is that you're most infectious a couple of days before you feel sick. So unless you've got a crystal ball, you actually don't know that you're infectious.
Wow. So in other words, you're walking around infecting other people, not knowing that you're actually sick as well.
That's right, for a couple of days. And then a lot of people who get sick don't get very, very sick, especially not at first. And so they might just have a sore throat or a blocked nose, so they might feel a little bit unwell, but not seriously unwell. They just go about their normal business, but they're actually shedding virus that's a risk to other people around them.
Wow. And what percentage of people who get infected actually die from coronavirus?
So if you've got really good hospital facilities and you've got access to good medical care, about 1%.
1%. So in
If,
places like maybe Africa or third world countries, what are the chances that people who obviously don't have very good facilities, does that mean then most more people would die because they don't have the
yeah,
facilities to actually look after their sick people?
yeah, because about 5%, that's 1 in 20 people need oxygen, extra oxygen to keep alive because the virus causes a pneumonia, blocks up their lungs, and they can't absorb oxygen from the air. So they need that extra oxygen to survive. But if they can't get to a hospital that supplies them with that, then they'll die. And then when things get really hectic and the hospitals are full and even basic medical care is not available, it can be even twice that. So that's what was happening in Italy when it was really bad in Italy. The hospitals were overwhelmed, so people would just come in with complications that if they were just 1 or 2 people, the doctors would have been able to see them and fix them up pretty well. But because they didn't have time, there were too many patients to deal with properly, those people also died.
So walk us through from the time somebody gets the infection to the time they fall sick. So give us an example of someone who, not necessarily who's a carrier, who doesn't really fall sick, but somebody who probably gets infected, gets really sick, and ends up in
Mm-hmm.
hospital. So what's the process with all that?
Okay, so someone would get exposed, and they probably wouldn't know that at the time, and then somewhere between 3 days to 14 days after that, they start to get sick. So most people it's about 5 days, but can be even up to 2 weeks. And they'll at that stage they'll feel slightly unwell. They might feel tired. They might feel like they feel a bit feverish, sore throat, or a blocked nose. They might lose their sense of smell or lose their sense of taste. And then they'll feel a little bit like they've got the flu for about a week.
Wow.
And then after about a week of being ill, they'll either recover or they'll get really, really sick. And that's the interesting thing about this virus is that most people who get very ill get ill in the second week of their illness. So after about 7, 8 days or 10 days, then they go bad. And that's when their lungs fill up with fluid. They don't absorb oxygen. They need oxygen to survive. And if it's really very severe, then they have to be intubated and have a machine do their breathing for them in intensive care.
So in the cases like you're saying, there's about 10,000 people maybe in Australia who've been tested and are positive to this
Mm.
virus. So if I was, for example, tested and I was positive, how would I know that I will not be one of those people who will end up being critical in the second week?
You don't.
So it's a wait and see kind of situation.
Yeah, unfortunately, yes.
Wow.
It's not. There are people who are at higher risk of getting seriously ill. So if you're older, that's more higher risk. If you have diabetes, it's a higher risk. If you smoke, if you're overweight, if you have high blood pressure, those are all people who have a higher chance of getting seriously ill. But because it's such a new disease, it's not really clear exactly all the factors that go to that. Um, so there are most of the people who have got really seriously ill in hospital have been older. But when I say older, I mean I'm talking about people in their 50s upwards
Right, right.
end up in hospital. The people that die, it's more people die in the older brackets. But you know, there's a baby who's currently seriously ill in Victoria now. There are some young children who've become seriously ill, even though it's less common. It does happen.
Right.
But on the other hand, you know, I've seen an 80-year-old person, you know, get very seriously ill, but he survived. And there's someone in his 50s who died. So we still don't really understand all of everything that's going on with this virus.
Would you maybe say it's also based with people's immune system, how strong your body is to fight diseases when you get them sometimes?
It is, but that's quite complicated. So your immune system's not just strong or just weak. It's good at some things and bad at some things. And if it happens to be bad at fighting coronavirus, then you do badly.
Wow. Okay. Now, and what drives mortality in people infected by the coronavirus? Is it just the fact that you said if they've got obesity problems, if they've got diabetes, if they're maybe got lung disease or those kind of things? Is that the only factor, or is there anything else?
It's slowly becoming clearer, but there are still lots of question marks. So one way is through pneumonia. So your lungs fail. They're too inflamed. They can't absorb oxygen. Without oxygen, you can't survive. So that's one way. The other thing that seems to happen is that all of your blood vessels seem to get inflamed, and you get small clots forming in different parts of the body. So we've had people coming in with heart attacks and with strokes, with blood clots in the lung, kidney failure, due to small, blood vessels clotting off. That seems to be a response to the coronavirus infection.
And what are the symptoms for people who maybe had those clots? What were their symptoms for them to kind of know that something's not right?
Well, like if they have a stroke, then they have a stroke. So, they might get weakness of the face or weakness of the hand or something like that, or it might be more severe. If it's a blood clot in the lung, then they'll find it hard to breathe. They might have some pain in their chest. If it's a heart attack, they might have pain in their chest, or they might just find it hard to breathe as they go into cardiac failure.
So, in other words, what you're saying is you would never know when you're getting those clots. Nothing would happen apart from the extreme where you're getting the heart attack or, the stroke. But when it starts to develop, do you get any symptoms or anything in your body that would tell you something is not right?
It's variable. I mean, I guess the thing is that we see people with strokes and heart attacks quite frequently in hospitals. These are common problems. But what happens with the coronavirus is sometimes even the people that don't get really sick with a very high fever and a pneumonia that okay, this is a coronavirus infection. There are some people that seem to get quite a mild coronavirus infection, but they still have this tendency to clot, and they might have a heart attack after that, and then to come in with a heart attack, but the heart attack was actually triggered by the coronavirus infection.
Wow, that's an interesting one. And what percentage of people, like we're talking about young people, right? You said that, so there's a talk of young people are the least. They're the ones who are least are dying of the coronavirus. What is this about young people? Is it because maybe they've got stronger immune systems, or what is it about young people that coronavirus is not such a big deal when it comes to young people?
It probably is something to do with the immune system, but nobody knows what just yet. So it looks like the people with atherosclerosis, so the people with chronic high blood pressure who've got their arteries get a little bit hard, and there's some deposits in the arteries. So and same with diabetes. So those people, you can see if this is something that's going to mess up their blood vessels, then they'd be at higher risk. Unfortunately, these days, with the change in lifestyle and diet and lots of sugary foods and everything like that, even before coronavirus, we were already starting to see young people developing what used to be called mature onset diabetes, or young people getting heart problems. Right. And these things which, when I was a medical student, things that were happening in people's 60s, might be happening in the 50s or the 40s now in some people. And so those people probably are at risk of, serious complications from coronavirus. And in some places, we're even seeing those kinds of problems in teenagers or people in their 20s. And so if those people get coronavirus, they probably are at higher risk.
What about children, like maybe young people, maybe 0 to maybe 10 years old or to 15?
Yeah, well, they seem to get off pretty easily at the moment.
They're surviving it.
Yeah, so it's interesting. The newborn babies, there are a few people with newborn babies that have got infected who do quite badly. And that's not quite clear why that's the case either. So, I mean, newborn babies, their immune system is not at all mature. So it might be related to that. But, young children, before they're teenagers, seem to be very mildly ill, hardly ill at all. But they can actually spread the virus in some cases, but sometimes they actually get it from their parents or their older siblings.
Because I would think if the young ones can have it and nobody knows about it, as you said, they can pass it on. And that means, when they're doing all this tracing, wondering where people have been, if they've been to school and they got, contaminated or caught the virus from somewhere from school and they come at home, and then it becomes a dynamo effect. So that would be something else which is probably not easy to detect.
Yeah, that's still being worked out too. So, I mean, traditional view of children is that they are the ones who pick up viruses at school and bring it home to their parents.
That is so true.
I've certainly experienced that, and most parents have. But in this case, a lot of the time, it's the kids getting infected from their parents. It seems overseas, where that experience is there's more experience overseas because there's more cases,
Right.
and so it does seem that sometimes the parents infect the children. But on the other hand, we don't test every child every day, and so it's hard to know exactly what's going on with the children because that information doesn't exist really yet.
Now, the other thing when I was talking to you yesterday that came to mind was, can you be infected? Can I be infected? And there is this notion of a lot of people, they think it's other people who can get this coronavirus and not us or not them. So what is your take on that? Because I think from where I'm sitting, I'm thinking coronavirus, there's no human that's exempt. Anybody can get it. What's your take on that?
Yeah, that's I think every single infectious disease, we hear that story. There's always other people that are at risk, and I'm worried about those other people at risk or whatever. But, we're other people too.
Well,
So anybody can get it. That's pretty clear. And it's not like other viruses which have existed in humans for a long time where, we might not have had that exact virus before, but we've had one like it. So our immune system kind of knows how to deal with it. This is new. This has never happened before. So it's the first time that any of us would be encountering it, and that's a risk.
so do you still believe, based on the fact that what we think we hear in the media, coronavirus was started because of people eating animals, bats and snakes and things like
I don't know
that?
about
Is there any truth in that?
I don't know about eating. It certainly came from animals,
Right.
and so it must have come from humans being in contact with animals at some stage. Now, which animals that was, we don't know. What circumstances were, we don't know. That hopefully will become clear as more research gets done. But, a lot of human infections come from animals because we interact with animals, domestic animals, agricultural animals, and then if we start, clearing forests and moving into habitat, then we displace animals that are already there, and we become in contact with species that we didn't really have much to do with before.
Right.
And this has been happening since we were, since humans were human, really.
Right.
But the difference nowadays is that there's lots of us, and we live really packed closely together in cities, and we move everywhere really, really fast.
Now, the other thing is, are there any safe and effective drugs to treat coronavirus?
So there are a couple. If you'd asked me 2 weeks ago, I would have said no. But
So we've done progress, right?
this is a very rapidly changing field. So there are a couple of drugs which seem to have some benefit. So there's one called dexamethasone. That's a steroid. So it's not a bodybuilding steroid.
Right.
It's more related to the ones where asthma preventer type steroids. So it's a higher dose than the one you have in your puffer, but it's the same kind of drug. And when the lungs are getting really inflamed with the coronavirus infection, this tends to reduce the inflammation so there's not as much damage to the lungs. So that seems to be of benefit. It's not a huge benefit, but it does reduce the risk of death in people that are needing oxygen. The other drug that seems to work is a drug called remdesivir, which is a drug that stops the virus from replicating in the body cells. And so if that's given, it does, again, seem to reduce the severity of the disease. But it's not clear at what point is the best time to give that one. Usually with antiviral drugs, it's best to give them as early as possible before the virus really gets going in the body. But the thing with this one, it's an intravenous drug, so it can only be given in hospital. And the other is then in the early
Oh, something's happened. Connecting. Chris, your line is cutting out. Okay, waiting.
Hello? I lost you there for a sec.
Yes, it said a weak signal. I think I missed that second point when you're talking about the second medication.
Oh, the remdesivir. Yeah, so it's an intravenous medication, so it can only be given in hospital,
Right.
and it's probably best to give early in the infection. But in this infection, the early phase, people don't really feel sick enough to go to hospital.
That's right.
So we might be missing the main benefit of it at this stage.
So then, how do you know which, like, if I thought I felt I've got the symptoms and everything, I wouldn't just go to the hospital and say, look, I think I've got COVID, test me. And if you find I'm positive, would I be in the stage where that could happen? I could get that medication put into me.
Mm. Well, there are lots of places to get tested. Hospital is one of them, but you know, if you're not sick enough to be in hospital, it's probably best not to go to hospital. There are doctors' clinics. There are lots of mobile testing clinics. There are private pathology labs that usually need a doctor's referral, but they can do the test. There are hotlines that you can ring to find out where your nearest testing centre is, or you can Google it and just go along and have the test if you feel that you've got any symptoms.
Wow. And what are the long-term consequences for those who survive COVID-19?
Again, so new that we don't know. Longest, the longest term there is about 8 months, because this started last December.
Yes, it's
So we don't know. I mean, I think you can imagine that there would be consequences if people have had strokes or heart attacks or kidney damage. You can imagine that there'll be consequences if someone's had serious lung damage with scarring. They might have lung problems going into the future. And of course, I mean, one of the most devastating things is because of the fear of spread within hospitals. There's a very, serious infection control measures, and people are in protective equipment, and patients are put in different rooms, and visitors are being banned from hospitals, and so on. So it's a very lonely and very isolating experience, being a patient who's coming into hospital with even suspected coronavirus, let alone confirmed. And I mean, to me as a doctor, that loneliness and that isolation for the patients is probably one of the most distressing things, I would say.
So in other words, what you're saying, their mental health, it becomes
Yeah,
worse because of all those factors.
yeah, yeah. And for people that are at home with coronavirus, I mean, there might be one or two people in a family who have it, but then the others are at risk of being exposed. And so there's all that stress of being in a house where you don't want to, expose other people in the family, or they're, afraid that you might expose them, and so on. So all of that tension and all of that stress is really upsetting as well.
So how can we go about that? If someone finds themselves in that situation, what is it they need to do to have maybe a better mental state, or what is it they can do about it?
I think educate themselves. So there are a lot of resources that are available. Our health department in Victoria has got a lot of resources. WHO has a lot of resources,
Yeah.
and a lot of it's translated into different languages as well, so you can find out how to protect yourself and your family. In the end, the things are, the main bridge to the infection is hand to the face, because unless someone actually coughs in your face or sneezes in your face, the only way it gets there is if you put it there. So if you touch something that's got the virus on it, and then you touch your mouth or you touch your nose or you touch your eyes, then you put the virus into your body. Unless you've washed your hands with soap and water, or you've sanitized your hands with an alcohol sanitizer. And so that's probably the most important thing. Once you've gone beyond, keeping the distance from other people, then the next step is actually to make sure you clean your hands before you touch your face and after you touch your face, because if you've got the virus and you've put it on your hands, then you can put it onto something else that you touched. So, you need to clean your hands before you touch anything clean, and after it, you've touched anything dirty. And the rider I say is that everything's dirty.
Well,
So,
the thing is,
yeah,
it's such a hard thing to do, because naturally we always seem to just do something that always touches your face, and we don't even know we're doing it. So it's one of those
yeah,
habits people have to probably consciously look at what they're doing with their hands, or find something to do with their hands, so they don't have to constantly do what we usually do. Like, I'm
it
talking to
really is.
you and I'm holding my
Yeah,
hands because I know I'm likely
yeah,
to do that, or and I'm
that's
thinking about what
exactly
you're
what I'm doing.
saying. Yes, I'm thinking about what you're saying, and I'm thinking, yes, there we go. Put your hands away
Yeah,
from your face.
Yeah.
So now the other thing, Chris, you know, there's a new rule in Victoria or Melbourne about compulsory wearing masks everywhere we go,
Mm.
right?
Mm.
So what is the right way to wear these masks? Because the funny thing is, I've seen people driving by themselves in the car wearing a mask, and I've
Mm.
seen people jogging wearing a mask. Now, I'm not too sure if you're alone in the car, what does a mask, why would you have a mask on when you're alone in a car?
Yeah. So the rules say that if you're alone in the car, you don't have to wear a mask.
Right.
Um, I guess the thing is, if you're the only one driving that car, that's fine. But if that car is being driven by someone else as well, when you're holding the steering wheel,
Oh,
you're breathing on the steering wheel. You know what I mean? So it is there. For the next person that comes in, they have to just remember to wash their hands before they touch their face, because the virus is not going to jump off the steering wheel into your face. You have to put it there.
right.
So again, the hand hygiene is really, really crucial. The wearing masks stops people from depositing the virus wherever they are. But once it's there, it has to actually be put there by someone's hands. And so that's the final bridge. The rules, people need to understand what the masks do, I think. The rules are very simple because once you make a law, you have to make it simple. Otherwise, it's just too hard to apply. And so they've said, once you're outside your front door, you wear the mask,
Right.
basically, unless there's a reason that you can't. Either you're eating and drinking or something like that, or you're in your own personal space in a car with someone else in your household. So it's really just trying to be very, very simple so that people don't get confused. Although, I would say nothing is simple enough to prevent everyone from being confused.
So, but like for example, what is the consequence for someone who would be jogging? Because if you're jogging or running, I don't. Could you wear a mask? Because I've seen people jogging with a mask on.
Yeah, so it would be pretty uncomfortable. They're not going to harm themselves by wearing a mask. The rules, again, also say that if you're doing vigorous exercise by yourself out in the open, you don't need to wear a mask. If you're just walking the dog or just taking a stroll, then you need to wear a mask. So they're trying to be pragmatic and practical, but encouraging everybody to wear a mask as much as possible so that the people who have the infection without knowing it don't spread it, and the people that don't have it don't get it.
So what about children? Because I was reading on the DHS website about kids under 12 are
Yeah,
exempt from wearing a mask. But again,
yeah,
kids could be also carrying the virus and contaminate other
yeah.
people. I know there is the risk of choking and things like that.
Mm.
But what are the guidelines around that?
I think the thing is, wearing a mask is not as straightforward as it sounds, because, as you said, we find it so hard to stop touching our face. And once you put your mask on, people are constantly adjusting it and touching it, and then
Mm.
pulling it down to talk, or dangling it from one ear and putting it back again, and all of that really decreases the effectiveness of it. Because you can imagine if you do have virus on the mask and it's protected it from getting in your mouth, if you put your hand there, then the virus is on your hand, and then next thing you know, you're putting the hand in your face when you're putting the mask back on. So it just makes it not as effective. So that's why they've made a rule that everyone should wear a mask who is able to do it right, and that means they have to be of a certain age and a certain maturity, because good luck with getting a 7-year-old to do that right.
No, that's a very difficult one. So the other thing too is with this mask situation, most people find them uncomfortable. What
Hmm.
is your advice for people who are still resisting the idea of putting on a mask because it's foreign to them? Maybe they don't see the benefits, like you just said. With the mask on, you're still touching your face because you're trying to eat, you're trying to talk, you're trying to do things. So you're still doing that. So people who are in that state where they feel they don't really need the mask but will put on the mask because they've been told to, what is your advice as a doctor?
Get used to it,
Okay.
which seems very brutal, but it's actually the truth. Um, when you wear anything that's new, it feels strange, and your attention goes to that part of your body, and it feels oversensitive and you want to keep touching it to check that it's still okay. That's normal. That's completely natural. But our brains are very amazing things, and they adjust. So if something's there all the time, then your brain just starts to say, okay, well, that's normal now. Let's move on. And you don't actually feel it as much. Once you form the habit and you get past that initial hyper awareness of that part, it actually is okay. So, give it a few days, push through that discomfort and that temptation to constantly fidget with it. It'll actually be okay.
Would it be more another thing of saying, well, you need to protect yourself and you need to protect other people? That's why you have to wear this mask?
Yeah, I mean, you need to remind yourself of the reason for it. But I would just reassure people that even though it feels uncomfortable and it feels strange and it's just annoying, that will pass after quite a short space of time. Once it's part of your normal, you barely notice it any more than you notice your clothes when you wear them.
And so what is the right way? There's a lot of talk of people just getting all sorts of masks. There's surgical masks, there's N95s, there's cloth ones people are making. So what is the right mask that is actually going to protect you? Because I was reading and I saw you could actually have a bandana if you didn't have a mask, because it still covers, but it doesn't really cover properly. So what are the rules around what mask is the right mask or the acceptable mask, or what actually is protecting you and protecting other people?
Okay, so according to the law, and again, they're being practical, something is better than nothing.
Right.
Is the bottom line. The surgical grade masks are good because they stop the droplets that are the main way that it's transmitted. So the droplets are they're microscopic, but they do fall, and they do only travel short distances in the air. And the mask will stop the person from spreading those kinds of droplets. They'll be caught in the mask. The N95 masks are there to filter out much, much smaller particles that are floating in the air. There are some circumstances where this virus, is infected, transmitted by particles like that, but it's only a few circumstances. If someone's seriously ill and they're coughing a lot and they're expelling, the air, and then there are some of those small particles that float in the air. There are some medical procedures which provoke that kind of spray coming out of the person's, airways. And if someone's in a choir practice and they're singing and their vocal cords are vibrating, they're spraying out that fine mist as well. But in most cases, it's not that. So in most cases, you're not trying to filter out particles floating in the air. You're just trying to stop yourself from spreading droplets that are going to land around you. So the surgical masks are fine. Cloth masks, again, will catch some of those larger droplets, but some of them will get through because they are microscopic. And you can see the weave in a piece of cloth. So clearly anything that's smaller than that can get through. So some of those particles can get through, which is why the multiple layers are recommended if you're using a cloth mask. And there are some instructional videos and pictures, again, on the health department's website and WHO, and a few other videos around that people can get shown how to make masks.
Right. Now I've got a question which I got from a viewer or someone who sent me this question, and they wanted to know if they had a family member who obviously got the virus, what would they need to do? Because obviously it's maybe a family of 8 people or 10 people and one person gets it. That means that person needs to be isolated or quarantined so they're not contagious to everybody else. What is the process with that? What do they need to do?
So the ideal thing is that they will have a separate room, separate eating utensils, separate bathroom, and that everybody will wash their hands with soap and water or sanitize their hands frequently, including that person. And if that person comes into the shared area, then they'll need to wear a mask. Obviously, putting that into practice depends on what kind of living space you have, how many people live there, how many bathrooms you have. So it's working out how to make that a practical thing in your own environment. But the main thing is just to think, how is it going to be spread from that person to other people, and then try and interrupt that. So sharing cups, glasses, knives and forks, clearly a bad idea. If that person uses them, then they should go straight into the dishwasher or or be washed. not used by other people. They should not be the one that's preparing the meals. If everybody should, wash their hands before and after they go to the bathroom, and it should be cleaned regularly. Any spaces or places that are touched by multiple people in the house should be cleaned regularly. So all of those practical things.
How would that work for a child? Assuming a child who got it, how would that work with the family? Because a child cannot be made to do things. You cannot make, like, as you said, 7-year-old to stay in their room and you can't get out because you're not well, and all these things, and everybody has to work around that. How would that work?
Yeah, like I said, it is tricky, and I think the thing is, everybody needs to do the best they can, particularly the washing of hands, and making sure that if they can reduce the amount of things that person touches, then the better, the easier it is to keep the things clean. But there are limits to what can be achieved, obviously. The main thing, I think, is not to be so terrified that you withdraw, from showing that person love and caring for them, and that people don't blame each other for what's going on in the house, and that the relationships don't suffer. Because there's also that psychological dimension, that social dimension of this. And, if people are accusing each other, or they're terrified of each other, or it's not good for anyone. Because again, physically speaking, most people won't get too sick. So that mental harm has to be considered as quite important as well. And the main thing is to make sure that you keep in touch with the doctor or the nurse who's looking after you, and be able to monitor yourself so that if you do get sick, you can go to hospital and get treatment.
So should we be afraid of coronavirus?
I think we should respect it. I think we should take it seriously.
Right.
I don't think being afraid is very helpful, because when we're afraid, we think differently. Our minds shrink. We stop being able to think creatively. We stop being generous. We stop being supportive of other people. And we stop being able to make decisions. We just panic and try to retreat into a corner, and we stop even being able to protect ourselves. So I think being afraid is not that helpful. Being respectful, taking it seriously, yes. Just like if you cross the road, you look both ways because you have to respect the cars.
That's for sure.
You don't have to be afraid of them. You do have to take them seriously.
Now, Chris, before we conclude, I know there's so many ways people can protect their emotional well-being, spiritual well-being, and physical well-being. What are 3 things people can do right now to start their journey to self-care? I know I can give examples of a few things, like probably eat healthy, exercise, still pay attention to other people's feelings and all this kind of thing. But coming from a doctor point of view, what are 3 things you could actually, or tools you could give them today and they can start implementing right now?
So I think physical health is very important. And like you said, eat well, sleep well is really important. Right. And keep yourself active. So if you're moving your body, your emotions actually do stabilize. Care for the people around you. Don't withdraw from them. Do remember that we all are bonded together, and we're all in this together, and we need to keep reminding ourselves what we're living for. And the third thing is, find something that makes you interested in doing more, not just for yourself, but for other people. It doesn't matter whether it's study or charity work or a job or, painting or making music or whatever. Just something that you can put into the world that is good, that's bigger than yourself.
Right. And now, coming back to you, what are you doing for yourself as a busy infectious disease physician to care for yourself as well and have a work-life balance? We talk about everybody else. You're caring for everybody else, but what about you?
Terrible at this. So I am trying to eat healthily.
Right.
I am trying to sleep on time. Okay. And I am making sure that, I'm taking my vitamin D, because I've got dark skin and I live in Melbourne, so I won't be making any of my own vitamin D until summer. Yes. And if you have a low vitamin D, actually your risk of severe coronavirus is higher.
Really?
Making sure that, touching my face, making sure that I'm, taking vitamin C and eating fresh fruit and vegetables so that, I have a healthy body. And I'm trying to educate myself about the situation that we're in. I'm trying to maintain my connections with my family and with the people that I train within sports, and I'm trying to do my bit to help everybody else through this situation through interviews like this and my work at the hospital. Yeah, so just trying to keep on.
So, what is it as a people or a citizen of the world that we can continue doing to inform, educate, and support people who are out there? Because, as you said before, and as we know, mental health is going to be a big deal because the impact of coronavirus on mental health. Obviously, people losing jobs, people being in isolation and all that kind of stuff. So, what is it as a people, citizen of the world, that we can all do as a collective to support each other in this time, especially?
Yeah, I think I think the main thing is to remember that we are all citizens of the world, and there are thousands of people in Australia who are being left out of financial support and access to the care they need because they don't happen to be citizens or permanent residents. They're temporary visa holders, they're students, they're asylum seekers, and they have been very brutally cut off from all support. They have been cast into poverty and abandoned by our government, being forced to work under any circumstances, even when they really should be staying at home and staying well. And that is devastating for them. And it is also a great risk for further transmission of the epidemic through our population. So I think anyone who's got any access to politicians or to public spaces should really lobby the government hard to make sure that everybody who's in this country is included in the support, financial support, social support, to get through this.
Wow, I didn't actually think about that one. That's a very painful thing to
Yeah,
listen to.
sorry, it makes me very upset, that particular topic. It's just a completely brutal attitude, which is based on a stinginess and a selfish kind of nationalism and a racism
What is it?
that
Is it to say you don't
un-
belong here, so we don't care about you?
yeah, it's like we'll use you for your labor, we'll use you for your university fees, but as soon as you're not useful, we'll throw you out. It's just terrible. It's absolute disgrace.
So, what are those people then? Because now you brought that up. People like in those situations, what is it they are doing actually right now?
They
Because,
are forced to rely on charity. So there are a lot of charitable organisations, the Red Cross, the Uniting Church. A lot of charities are helping them with food. So they're standing around getting food parcels and clothing in the cold and so on. Um, and there are people there are health services, public health services, who provide them with medical care because sometimes people don't have Medicare either.
of course.
But really, they're just trying to hold out. A lot of people left and went back to their countries, but so a lot of people cannot do that. So they're stuck here, and they're really in such a desperate situation, and it's getting worse all the time.
Wow, that's a topic that it's a little bit hard to understand how people can be so inhumane about that.
Mm.
Wow. Now I'll just have a quick look and see if there's any questions on the chat, just to make sure, see if the viewers have any more questions before we finalize our interview. Just one more thing. Well, I've got someone who's actually asking the question about, the commission flats, the way they had the lockdown and
Yeah,
everything.
yeah,
And they're still concerned that obviously there might be cases of people who've had, the coronavirus and everything. But the concern is what is going to happen, not necessarily to them in that specific
mm,
space, but a lot of people in there already had mental health issues.
yeah,
And with
yeah,
this, what's happened and also what's actually still going on, it's escalating. And a few people, I got to see someone saying a few people have tried to commit suicide. What's your
yeah.
take? What would you say to them? What advice would you give them to get hope or to just see there's hope at the end of the tunnel.
Okay, so that was a really disastrous situation that happened there. It happened because the planning was extremely poor, and the voice of the community was completely ignored, and that was in the lead up to the outbreak. After the outbreak, a very police-heavy, thoughtless response was initiated, again without any discussion with the residents. The residents themselves organised themselves so impressively, so fast to take care of each other, to make sure that people were being looked after for their basic necessities of life, that they were organising people outside to come and help them. They were negotiating with the government response team to try and get things done and look out for each other. It is one of the most impressive kind of collective actions I've ever seen. I can barely even capture that in words. They have now got a system where they're able to talk to the department services on site, and got some processes to make sure that people are being looked after, that things are actually starting to work now. And they've got a health service which is working with them, and volunteers outside who are working with them. And the resources within the community are so amazing, and I hope that we learn from it, that that's where the answer to this whole pandemic lies, is in communities working with government and with professionals to create solutions to the problems that we have, and really do it together, not be just told what to do and pushed around, and trust that everything will be okay, because if we do what we're told, we have the answers within us and between us, and we need to put that forward. It's actually the same lesson that we should have learned many, many years ago, when we're dealing with a whole lot of chronic diseases and mental health and social issues, that if community and government work together, then we can really get to a good place, and if we don't, we are in a really terrible place. The difference with coronavirus is it happens so fast that it's visible within the span of a media cycle, I guess you could say.
Right.
And so I really hope that that's what we learn from that, so that we can do much, much better going forward.
Wow. Now, Chris, we've come to the end of our broadcast today. Is there anything else you would like to add? Something that maybe might be helpful to any listener listening?
I think just learn. Keep your eye out. Learn. Make sure that you are learning enough to spot the good information from the misinformation. There's a lot of. This is the only epidemic where the news of the epidemic travelled faster than the disease. And there is actually, and it probably even out the scale of the information about it even outstrips the disease itself. So there is a lot of material out there, and most of it's crap. So, it's really important to check the reliability of the sources, to judge with a critical eye what you are told and what you find out and what you tell other people, so that we can come to some attachment to reality that's going to get through, instead of winding up with crazy paranoid fantasies and weird things that are just destructive and divisive.
It's interesting you say that, because another thing for self-care would be to not listen to the news all the time, and also, like you said, to just find the information from credible sources, like, for example, the health department, probably, places where they actually have facts, not just stories, because a lot of people don't even know what's going on. Like, I hear a lot of people talking about COVID-19, but then we run with the story based on what the other person has told us without knowing where they got the information. And in the process,
it's good to check.
Yeah, and in the process of that, we get fearful, we're not sure, we start getting anxiety, and everything is just a panic mode for everybody. So
I think it's important to remember that, I mean, even the science is changing and it's evolving, by the day. So the more critical eye, the more sources you look at, just look at them with a critical eye, because we may be saying one thing one week and then new information comes out, we say something else. It's because we're working on the best information we have at the time, and some of it's wrong. We just have to remember that some of it is going to be proven wrong, and we have to keep ourselves informed. And eventually we'll come to a much better state of knowledge. But we are all learning. We are all learning. And we've got things to learn in science. We've got things to learn in everyday life, how to manage this thing in practical terms. And the moral questions, the ethical questions are also important. And we have to have a response on all of those levels.
So where should people actually really go? Now, I know about the health department, like I'm going to put that up later after this broadcast. Where should people
Yeah.
go for credible information about COVID-19?
So there are government departments, there are government sources, there are also scientific bodies that put out information. If people have got a health background, a scientific background, or they feel comfortable reading that literature, a lot of the scientific journals have actually made all the coronavirus-related material free access for everybody. The WHO has got a lot of information, but a lot of the local health services have information as well. And I'm hoping that people like yourself and others who have got a platform will be part of, the sharing that sort of information as it comes to light.
Right. Well, I hope everybody who's listening has learned something. And if you have any questions, please feel free to send us questions, because that's why we're here. We're here to support you. We're here to give you credible information. We're here to share so that you can help other people as well. So that's all for today, Chris. Thank you so much for your insight and shedding some light on COVID-19. And thank you, viewers,
Thank
for
you.
watching the CWK show, Conversations Live with Katinda. Until next time, good night.
Thank you very much. Bye.
See you.